All right, in Health Matters today, we are once again talking about GI issues, and this covers really a wide range of problems people deal with every single day. News Channel 3's Hattie joins us once again with an expert from Cabell-Huntington Hospital.
Hey, Dr. Akash Ajmera back with us today from Cabell-Huntington Hospital. We continue our discussion on GI issues and the different procedures that there are for dealing with these kind of conditions. So what are some of the popular procedures that you've been doing?
Most commonly performed procedures in gastroenterology or in our hospital at Cabell is upper endoscopy or colonoscopy. Now, colonoscopy, as you know, is done to look for polyps that could potentially to cancer, and then thereby preventing something that could lead to a lot of disease and problems later on. So colonoscopy is one of the most popular. Endoscopy we do for patients who have stomach issues like pain, ulcer kind of things, bleeding, patients who have trouble swallowing, patients who have reflux disease that is not getting better with medications. So we do a lot of other specialized procedures too. To name a few would be endoscopic ultrasound, which is a very new modality in this field.
Oh, it's generally new? Okay.
It's kind of new, newer, I would say. And it specializes in doing ultrasound along with an endoscopy, so it's a very close scanning of some of the structures.
Okay.
We do something called Ercp, which is endoscopy to remove stones and look at the bile ducts that drain the bile from the liver. It's usually done to remove stones there, which makes people really sick sometimes. We do pressure recordings of the esophagus for people who have trouble swallowing, called esophageal manometry. We also do a very special procedure looking into the small intestine, which is very difficult to visualize otherwise, by doing a special capsule recording or doing a special longer scope with a balloon that goes deeper into the intestine. So we do a lot of different
procedures and a lot of different things going into each one of them. It's kind of hard to keep up with. But when it comes to this, the endoscopic ultrasound, how does it match up with a CAT scan or an MRI? How do you compare all three?
So endoscopic ultrasound has a couple of advantages. One is it scans very closely because it's usually done to scan the pancreas, the liver, gallbladder, the ducts around there, and because the are attached very closely to these organs, if you put a probe and an ultrasound right there, it doesn't interfere with any other things, but is able to scan these very closely. And also we can also put a needle through the ultrasound guidance at the same time and take biopsies of lesions if they need diagnosis.
Okay, and then just finally, when it comes to talking with your doctor, sometimes they have to refer people to you. So when should that happen?
This procedure is very useful in diagnosing and staging of cancers, esophageal cancers, gastric cancers, rectal tumors, pancreatic lesions, anything to do with these, they should be referred to for an endoscopic ultrasound, because that has the advantage of looking at the tumor very closely at the best way to do it. A lot of times you can do therapies like draining cysts of the pancreas, therapies like injecting drugs into the pancreas for tumors and chronic pain issues with chronic pancreatitis.